Inhalationi. Yanthixi transmission. Breathing. Primary survey Y. Incubation 1 to 6 days. Anthraxy. Rash/spot on tongue mouth. Smallpox symptoms. Respiratory muscle aches. Yanthraxy symptoms. Spreads down body. Smallpox symptoms. Most severely injured or ill victims who require the greatest resources are treated last to allow the greatest number of victims to receive medical attention. Why? Reverse triage. Malaise, a general feeling of discomfort, illness, or lack of well-being. Smallpox symptoms. Preparedness plans. Preparedness examples. Skin blister. Yanthraxy symptoms. Activities following a disaster. Recovery. 2 pairs of gloves. Nuclear radiation decontamination. Spread by direct contact. Smallpox transmission. Aerosol. Smallpox transmission. Aerosol. Smallpox transmission. Expose environmental Y control evidence. Primary survey Y. Any patient who does not have respiratory effort after attempting to open the airway. Expectant to see CDY black triage tag color. PT must be isolated. Transmission precaution/standard contact. Droplet and airborne. Y. Smallpox. Masks. Nuclear radiation decontamination. Building codes and zoning. Mitigation examples. Respiratory cough. Yanthraxy symptoms. PT must be isolated. Transmission precaution/standard contact. Smallpox. Respiratory cough. Yanthraxy symptoms. By droplets person to person. Smallpox transmission requires medical attention within minutes for survival/up to 60. Y. Immediate emergency Y red triage tag coloring. Circulation Y. Primary survey Y. After 1 to 2 days, a maculopapular rash appears on the face, mouth, pharynx, and forearms. Smallpox symptoms. Long-term medical care and counseling. Recovery examples. Dosimetry devices. Nuclear radiation decontamination. High fever. Smallpox symptoms. By droplets person to person. Smallpox transmission. Understands that the role varies during disaster. Nurse's role during a disaster. Face-to-face exposure. Y. Smallpox transmission. Includes compromises to patient's airway, breathing, circulation blockages, or an obstruction in the airway. This is the compromised airway. Immediate emergency Y red triage tag coloring. Must understand ethics associated with choices they might have to make. Nurse's role during a disaster. GI, bloody diarrhea. Yanthixy symptoms. Palliative care and pain relief should be provided. Expectant to see CDY black trash tag color. GI ingestion. Yanthixy transmission. Skin ulcer with black spotty. Yanthixy symptoms. NNV. Yanthixy symptoms. Managed care is a healthcare delivery system that focuses on decreasing costs. We don't do repetitive care and improving outcomes. Patient satisfaction requires a collaborative effort from the interprofessional team. Required healthcare providers and agencies to work together. Managed care, what is it? What are the benefits of using it? Virus. Smallpox. Warning systemsy. Preparedness examples. Water-resistant gowns. Nuclear radiation decontamination. Disaster drills should be conducted at least twice annually when involving community-wide resources and actual or simulated clients. Why? Nurse's role during a disaster. Skin lesions. Yanthixy symptoms. Cover floor and use strict isolation precautions to prevent the tracking of contaminancy. Nuclear radiation decontamination. Activities during a disaster. Response. Skin, small sore. Yanthixy symptoms. Status unlikely to deteriorate over days. Minor, non-urgent YY green trash tag color. Must strive to maximize patient safety. Nurse's role during a disaster. Bums filled with thick fluid with depression in middle. Smallpox symptoms. Caps. Nuclear radiation decontamination. Backache. Smallpox symptom. Fever. Smallpox symptoms. What is their scope of practice? What have they been trained in? Or maybe if they haven't been trained in it, they need to speak up. Ethics and legal issues. Respiratory fever. Why? Yanthixy symptoms. Age history, past medical history. Secondary survey. Respiratory, sore throat. Yanthixy symptoms. Backache. Smallpox symptoms. Body fluids. Smallpox transmission. G. Give comforting. Secondary survey. Abdominal pain. Why? Yanthixy symptoms. Headache. Smallpox symptoms. Activities prior to a disaster. Preparedness. A severely injured patient who needs evaluation and treatment but may not require immediate transporting. Delayed urgent YY yellow trash tag coloring. Raised bumps. Smallpox symptoms. Abdominal pain. Why? Yanthixy symptoms. Activities prior to a disaster. Preparedness. Age history allergy. Secondary survey. Why victim unlikely to survive given severity of injury C. Expectant deceased CDY black trash tag color. Woody C. Nuclear radiation decontaminatione. Direct. Yanthixy symptoms. Exhaustion, an overwhelming urge to sleep, and you may not feel refreshed after you rest or sleep. Smallpox symptoms. Staph protection Y. Nuclear radiation treatment is supportive care with antibiotics for any additional infection, pain medication, itchy medication Y. Smallpox. Staph protection Y. Nuclear radiation decontaminatione. Any patient who will die before appropriate treatment is available. Expectant deceased CDY black trash tag color. Claims processing and grants. Claims processing refers to the insurance company's procedure to check the claim requests for adequate information. Recovery examples. Pustular rashi, a patch of large red bumps that have pus inside. Smallpox symptoms. Why victim with relatively minor injuries, patients requiring minor treatment or prophylactic evaluation. Prophylactic intended to prevent disease. Minor, non-urgent YY green trash tag color. Victim can be helped by immediate intervention and transporting. Immediate emergency red trash tag coloring. Public warning systems. Response examples. GI, undercooked meat or diarrhea from infected animals Y. Yanthixy transmission. Fever. Yanthixy symptom. Search and rescue. Response examples. Respiratory chest pain. Yanthixy symptoms. Must be aware of their employer's response plan Z. Nurses' role during a disaster includes serious and potentially life-threatening injuries, but status not expected to deteriorate significantly over several or C. Delayed urgent YY yellow triage tag coloring. Temporary housing. Recovery examples. Emergency exercises training. Preparedness examples. Fever. Yanthixy symptom. Fever. Yanthixy symptoms. Be aware of state regulation. Nurse's role during a disaster. Mental status unable to follow simple command C. Immediate emergency red triage tag coloring. Use standard precaution C. Anthixy precaution goggles. Nuclear radiation decontamination involves over 100 people. Mass casualty instances. Age history less mealy. Secondary survey. Use standard precaution C. Anthixy precaution C. GI nausea. Yanthixy symptom. Age history medication C. Secondary survey. Age history events surrounding injury. Secondary survey. Respirations greater than 30 per minute. Immediate emergency red triage tag coloring. Nurse manager and nursing supervisor CNA restock the supplies. They can bring the patient down right. They can transport throughout the hospital. Delegation. Skin contact Y. Yanthixy transmission. Respiratory symptoms that mimics influenza. Yanthixy symptoms. GI nausea. Yanthixy symptoms. Skin contact Y. Yanthixy transmission. Does not spread from person to person. Yanthixy transmission. Air ducts and vent are sealed. Nuclear radiation decontamination. Respiratory inhalation. Yanthixy transmission. Activities that reduce the effects of disasters. Mitigation. Skin direct contact. Yanthixy transmission. Clothing bed linen. Smallpox transmission. Varroa virus Y. Smallpox cause. Respiratory inhalation. Yanthixy transmission. Bacillus Y anthracis. Anthixy cause. Disability neurologically. Primary survey Y. I inspect posteriorly. Examine the patient's anterior and posterior chest. Secondary survey. Antibiotics within 24 hours YX 60 days. Anthixy treatment. Extremely contagious. Smallpox transmission. Tried outside the hospital. Nuclear radiation decontamination. Age history. Secondary survey. Incubation 12 days.
Hello. 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 Yes, yes. She is my wife. Yeah. I'm the one calling. Oh. Okay, wait for a second. No, wait for a second. She in the west room. Yeah, wait for a second. She in the west room.
Incubation 12 days. Incubation 12 days. Smallpox. Respiratory SOB. Yanthixy symptoms. Public education Y. Mitigation examples. Any patient who cannot walk but has respiratory drive and are within normal limits with RPM equals respirations, pulse and mentatione. Delayed urgent YY yellow triage tag coloring. Emergency operations. Response examples. Open source. Smallpox symptoms. By contact with clothing or linens. Smallpox transmission. Incubation 12 days. Smallpox. Incubation 12 days. Smallpox. Perfusion, no radial pulse or capillary refill time greater than 2 seconds. Immediate emergency red triage tag coloring. Vulnerability analysis, a review that focuses on security relevant issues that either moderately or severely impact the security of system. Mitigation examples. May be able to assist in own care any ambulatory patient walking wounded Y. Minor non-urgent YY green triage tag color. YF full set of VSI. Secondary survey. Airway with cervical Y spine stabilization Y. Primary survey Y.